Welcome to our mnemonic video on shortness of breath differential. Let's get started. This scene will take place at a marketplace in the mountains of Colorado. We can see our first character bent at the waist and struggling to breathe as he carries a heavy load of stuff into the marketplace. This idea should help remind you of shortness of breath, which is the focus of this video. To the right of the main road to the marketplace, we see a butcher shop. The shop carries many kinds of meat, but the most compelling item for sale is their bison heart, displayed front and center. If we take a closer look, we can see that this heart is covered in black streaks that resemble ischemic areas. That bison heart looks far too unhealthy to have done its job properly, even when it was beating inside the bison. Anyways, this idea here should remind you of an acute coronary syndrome, which results from ischemic heart events and a serious cause of chest pain as well as shortness of breath. The butcher shop is known across the land for its bison meat, and the butcher is expecting a lot of customers this evening. Notice that he has placed out a tall stool with a broad base, our symbol for ST segment elevation. Next, we can see a short or depressed stool, which will represent ST depression, and finally a stool that is upside down for inverted T wave. These are the most common findings seen on an EKG in acute coronary syndrome. Now let's meet the butcher that runs the shop. He has created a small fire to start cooking the meat that he'll serve to his customers. The smoke from the fire starts blowing towards the meat booth, and the butcher starts coughing. You can see that in addition to coughing, the warmth from the fire is making him very hot and is causing him to sweat. The butcher's fever, sweats, and cough should remind you of the symptoms of pneumonia, which is another one of our differentials for shortness of breath. Part of running a successful meat shop, especially if you're prone to coughs and fevers, is having an apprentice to help you out. Let's take a look at what the butcher's young apprentice has gotten up to. A little ways behind the butcher's booth, we see the industrious apprentice halfway up a tree. He's been helping the butcher collect wood to feed the fire for the meat. Unfortunately, while he was busy sawing and collecting branches, he was not paying much attention and made the mistake of cutting off a branch with the beehive hanging off of it. The bees, clearly upset at this unwelcome visitor, have begun to fly around and sting this poor apprentice's face. This apprentice looks confused and anxious, as this all happened very quickly. He is having a very severe allergic reaction, so we can see hives and swelling all over his face where the bees have stung him. His mouth is open as if to yell, but no one is paying attention to him as he is not able to make any sound. He's definitely having some trouble breathing. Anyway, this quick onset of hives, swelling, and tightness of the throat represents the symptoms seen in anaphylaxis, which can commonly be brought about by bee stings. And this scene should help you remember that anaphylaxis, represented here by the bee stings, is another one of our differentials for shortness of breath. While the apprentice is busy warding off the bees, let's take a look at the interesting looking tree he's climbed up and where he's left his saw. Curiously, the leaves and branches on this tree are shaped like the lobes of a lung. It looks like he has placed his saw at one of the branch points of the tree's trunk. As we follow the branches stemming from the saw, we can see that all the leaves have fallen off of them. These dying branches stemming from the saw should remind you of a pulmonary embolism, which is a blood clot that blocks off blood flow to all the vessels beyond the site where it lodges, causing hemorrhage or ischemia. The triangular pattern of branches with leaf loss distal to the saw should also remind you that pulmonary emboli classically cause a wedge infarct, or Hampton's hump on a chest x-ray. The location of the saw at the branch point of the trunk should also remind you of the most feared type of pulmonary embolism, called a saddle embolism, which lodges at the bifurcation of the pulmonary artery. It seems as if the butcher and his apprentice are going to great lengths to ensure their customers' comfort and satisfaction. They must be expecting a really important customer. At the entrance to the marketplace, we meet the sheriff, one of the most influential residents of this Colorado township, and a loyal customer of the meat shop. He is primarily there to purchase the butcher's renowned bison meats, but is wearing his uniform and holding a whistle in his hand, just in case he has to intervene in any marketplace disagreements. His uniform identifies him as part of the Colorado Police Department, abbreviated COPD, and that should remind you of chronic obstructive pulmonary disease, which is abbreviated as COPD as well. And if we take a closer look at the sheriff's whistle, you'll notice it's an inhaler to remind you of asthma. The whistle and uniform together represent asthma and COPD, which should be on our differential diagnosis for shortness of breath. Now, let's take a look at the different shops in the marketplace. To the left, we can see a tall, skinny fishmonger smoking up a storm. Perhaps the copious amounts of tobacco smoke is a marketing strategy to cover up the smell of his questionable merchandise. At today's market, he's showing off his prized item, a thorax-shaped fish tank, which has seen some better days. Unlike most fish tanks, this one is clearly broken. A portion of the cage has been smashed in, and all the glass in between the ribs have shattered. Now the cage is just filled with air. This empty, air-filled thorax tank represents a pneumothorax, one of the differentials for shortness of breath. The damage on the side of the thorax tank should remind you that a pneumothorax can occur due to trauma, like a broken rib or stab wound puncturing the pleura of the lung. The tall and skinny fishmonger should remind you that a pneumothorax can also happen spontaneously, and these often occur in tall, skinny males due to thin-walled blebs under the pleura at the top of the lungs. The fishmonger is smoking, and this should remind you that smoking can predispose someone to have a spontaneous pneumothorax. No marketplace is worth its salt without a local thief eyeing the wares. Hunched over the fish booth is our thief, visibly anxious while scoping out the lay of the market. He's usually calm and collected while snooping around, but he has just noticed the police officer at the other end of the market. You can see that the thief looks like his breath is caught in his chest. This scared, breathless, anxious thief is our symbol for anxiety, another differential for shortness of breath. And with that, we've wrapped up our differential diagnosis of shortness of breath.